Well, hello, welcome everyone. So it's 1 o'clock, and so I'm going to go ahead and call our meeting to order on today, September 19th, 24 at 1 o'clock. So Tiffany, I believe I seen Tiffany. Yes. Okay, so Tiffany, if you want to go ahead and do roll call, I believe we have 15 participants on this meeting here. And as they're coming on.
Okay, I've just been trying to write down names, so.
Okay.
Kaylee Hendrickson, Ron.
Here.
Dr. B.
Here.
Ina, sorry.
Here.
Travis. I've seen Travis on there. Oh, he's
yeah,
new.
Travis.
Okay.
Present.
Tammy Reed, sorry. Is there two Tammys on here? Okay. And Tamara Higgins.
Here.
Jared.
Here.
Christine.
Here.
I see Jody on there. Jody. Cassie Doty. And Jennifer Severance.
I'm here.
Okay. I think I got everybody.
And Sarah Ross.
Yes, Sarah Ross, please.
Sorry, Sarah Ross. Oh, I had her name down. I forgot to call her name.
Okay. Okay.
Okay.
All right. I think that's everyone. All right. Thank you, Tiffany.
Mm-hmm.
All right. So from our last meeting minutes, Tiffany, did Brandy share those?
I think the minutes that I took last time were from the U.N.I.T.E meeting because we didn't have a board member meeting. We only had the one meeting.
Okay.
Yeah.
So,
Yeah. Do you remember that, Jared?
Last month you're talking?
Yeah.
Yeah. So last month would have been our just regular board meeting.
board.
Yeah.
Oh yeah. Okay. Sorry. We only had one or the other. We didn't have the two meetings.
Okay. So I believe that was in June or July.
Would have been June.
June. And I don't have the meeting minutes from June.
Yeah.
Okay.
I know Brandy was gonna try to jump on. I'll just text her and see if she can send those to us.
Okay, I appreciate it, Tiffany. Thank you. So we'll just wait for those from Brandy on that. So we'll go ahead and just move into agenda item number 4, the treasurer's report.
Hey, Jared, you probably have that ready.
Yes. Yes. And so hopefully everyone received that. So for August, we had expenses of $105, but we had some income of $250. So the net profit for the month of August was $145. And when we add that to the prior months this year, we have a profit of $4,940. So through August, we've made just under $5,000. When we add that to the money that we had prior to this year, we have a total of $20,855.23.
Okay.
Are there any questions?
No questions, Jared.
Okay.
Is there a motion to go ahead and approve the treasurer's report?
I make a motion that we approve it as presented.
Thank you, Dr. B. Is there a second?
I'll second that.
Thank you, Ron. So Dr. B put a motion in to approve the treasurer's report as is or as reported, seconded by Ron. Okay. All right, thank you, Tiffany. I did receive the message, so we'll just be looking for those minutes from Brandy. I believe it said tomorrow, so Okay, so let's go ahead and move into agenda number 5, the KAI report.
Sure. So hopefully everybody got this month's issue of Collaborating Times yesterday in their inboxes. Content for the October issue, if you haven't sent it already, is due next Wednesday, the 25th. That's also the day of our next LTSS webinar, Fall Free Fridays, Expanding Education to Prevent Injuries. We have a presenter from the Area Agency on Aging District 7 in Ohio. She's going to talk about their award-winning live stream that is starting up again this Friday, not this Friday, the 27th actually, to get the word out about fall prevention. And then we have an LTSS newsletter going out Monday, the 23rd. And I think that's it for my updates. Thanks.
All right. Thank you, Christina. All right. So let's go ahead and go into the leading age report.
Yeah, just couple things to make sure everybody's aware of. So of course, you know about the facility assessment requirements for your staffing standards rule that would change into effect at the beginning of August. Leading age is continuing forward with American Healthcare Association with the lawsuit against Department of Health and Human Services regarding the staffing standards. That is moving forward according to the schedule that was agreed upon by the judge. We just found out yesterday, so the Texas Attorney General had also filed a very similar lawsuit in the same court in Texas, and then had filed a motion to have that case combined with our case, and that was granted yesterday. And so that case will move forward in parallel with ours. It will be on the same timing as ours. Does not pose a threat to our lawsuit in any way. So that's all moving forward. The timeline for this, CMS had to, or HHS had to file a brief by this past Friday, which they did, and that was something like 75,000 pages. And so what comes next then is motion for summary judgment. Both sides will file, I believe it's a brief, and then the other side has a chance to file the response. And then all of that is planned to wrap up, or that will take place between October and January. They'll wrap up by January. And so there is an anticipation that we will have a decision on this case sometime in early 2025. In the meantime, of course, we are preparing for implementation in the spring of 2026 as the first line of implementation for places. And then the other thing I wanted to make sure everybody was aware of, we've heard a lot lately about unannounced visits from CMS contractors. When the contractors come in, it's somebody from a subcontractor. So they have a badge, but it's usually a subcontractor badge. It doesn't say CMS on it. They have a letter from CMS, but they don't always produce the letter. Even if you ask for it, they might not know what you're talking about, even though they're supposed to. And when you ask, why are you here? They often say things like, I have to take photos. It's for compliance. If you don't let me in, then this jeopardizes your provider enrollment. So understandably, people are getting freaked out about this. These visits are legitimate visits. These are part of the provider enrollment and revalidation. The thing is, revalidation only happens like every 5 years. And of course, the past 4 years have been the public health emergency, so these visits weren't taking place. And so it might be like 10 years since the last time you had this type of visit, and who knows how they were being conducted at that time. And so a lot of people are just not familiar with this at all. And then when the subcontractors are not able to use language that we understand, like provider enrollment, revalidation, it gets people kind of, tense and uncomfortable and uncertain about whether they should let this person in. So we've been working with CMS to make sure that all of the contractors and subcontractors are kind of being given this background information about like why we might be reluctant to allow someone in, where the communication issues are. Hopefully, we have asked CMS a couple of times now, please ask the subcontractors to say these specific keywords. In the meantime, we are trying to raise the awareness among members that these are legitimate visits. When someone comes into your building and presents and asks these sorts of things, you can ask to see the ID, and you should ask to see the letter from CMS. You're not allowed to photocopy either of them, and you're not allowed to retain either of them, but you can look at them, you can review them. And if you have any questions about whether this is actually one of these revalidation visits and whether you should be allowing this person in, then you would contact the Medicare administrative contractor. They can verify it. Oftentimes, members are contacting the state survey agency. Sometimes they're even contacting the CMS regional office. And in both cases, the CMS regional office, the state survey agency, they're like, we have no idea what you're talking about. We can't confirm this. And then that gets people even more freaked out. So your MAC is the person that, or is the group that you want to be contacting to confirm or to validate these visits. But if anything like this comes up, please email me. Unfortunately, the interactions are not always positive because of this background where the nursing homes feel very reluctant and uncertain of whether this is something that they should be participating in. And then the contractors don't understand the reasons for that. So then they get really frustrated because they're being prohibited from doing their jobs, and it can become kind of a tense standoff. So certainly if that's the case, let me know, and we're communicating with you. So.
All right, thank you, Jody. Does anyone have any questions on that? Wow, for them to be able to do that, that's I never heard of that, but you said it happens every 5 years for that. So.
Yeah, and actually, there's an article on our website. I'll drop that in the chat so that way you have something to look at instead of just trying to remember everything I fired at you in the past moment.
Okay, thank you, Jody. Does anyone have any questions for Jody? All right, if not, we're going to go ahead and move forward with our agenda 6 item. Thank you, Jody. Oh, I'm sorry, not 6, because we just got done with that, Jody. Our number 7, so the committees. So the website, outreach and tribal consultation, and business ventures. So I'm not sure who would like to start on this and what part. Ron or Jared?
Well, I would just maybe give a little update about the outreach committee. I think our goal was to invite some individuals that might be interested in U.N.I.T.E, at least gain some more information. I know there's, you can watch webinars and things that have been put on by U.N.I.T E members, but sometimes it's just nice to be invited to and be able to attend a meeting and then start to understand what U.N.I.T E is about. And I noticed that Cassie Doty was able to join us. And I would just give a little bit of information about her for the rest of the group. She is the administrator for the Flandreau Santee Sioux Tribe Care Center. It might be the newest facility, if not almost the newest facility that has been built in the United States there. It's a really nice facility, 42 bed. Cassie, is there anything that you would like to maybe just say in particular about your facility or about anything?
Geez, put me on the spot.
I'm not trying to. But.
No, I think you kind of hit the nail on the head. I'm fairly certain too that we're probably one of the newest ones. So we wrapped up construction for the building at the end of 2022 and had our first day of operation on February 1st of 2023. So we went through the whole initial survey process, gaining licensure, working a lot with CMS in that process, and of course our state survey agencies and things like that. And yeah, so we've been going for about 1.5 years now. We're, like he said, 42 beds. We have a current census of 21, so we're about halfway full. And yeah, and 14 of those beds are also memory care. So our general population is just about full. And now we're starting to hammer out the opening up of a memory care unit and what all that entails.
Thanks, Cassie. I'm glad that you're able to join us. So Cassie was the only one that I had reached out to. I don't know if there's anyone else on that maybe someone else had invited. I just think it's nice to be able to recognize any visitors or anyone that was able to attend and wanted to gain a little bit more information. But otherwise, that's all I had for committee update.
Okay. And Jared, are we going ahead and using the membership letter that you sent out? Because I believe everyone concurred that it looked good, and to use it. So
Yeah, that's what I used. So
okay,
and that was my understanding as well, that we kind of approved that letter as what we would be able to utilize.
okay, perfect. All right, thank you. And welcome, Cassie. And congratulations. That that just sounds wonderful. Being in sounds like especially the memory care unit that in your facility there. So I look forward to hearing more about your facility.
Well, thank you. I appreciate that.
All right. Do we have any updates for the website, our business vendors?
Not today, Ina.
Okay. We could save it for Nashville. All right, so that'll just go ahead and move us into our agenda number 8, old business. And so on there, I put the annual U.N.I.T.E meeting that's being held in Nashville, Tennessee on October 28th. We hope everyone could join us, but if for some reason that you're not able to be in person in Nashville, Christina, KAI, they have sent out invite for the meeting so you're able to connect with us over Zoom. And so for some reason, if we don't have everyone's emails to join us, I guess we can get that to you guys. Is there any other updates for that before I go ahead and move on for the annual meeting? I know we're like in the final stages of finalizing that. No, Jared, how's it coming along on the, oh, go ahead, sorry.
This is Deb.
Oh, yeah.
Just got off a meeting with our managers in the facility. I wasn't there in the beginning. Sorry if this was already discussed. The last U.N.I.T.E meeting, we contributed a star quilt. Question is that being done again this year?
I don't know if there's been any discussion on that. Because was that when we had the booth?
Yes, I
We did
believe it was.
Okay, and I don't believe we talked about having a booth at this at the Leading Age conference this year. What does everyone feel on that?
Yeah, we probably aren't going to be able to make that work, Ina.
Okay.
Okay.
Yeah.
Thank you.
You're welcome, Deb. All right. So with that, I'm gonna go ahead and move into our agenda number 9, our new business. With us, we have some guests with us that joined us on the meeting. So first is Dr. Jennifer Severance and Dr. Sarah Ross. And so they're going to be presenting for us. And as you see on the screen, and so what I'm going to do is go ahead and hand it over to Jennifer. Welcome, Jennifer and Sarah.
Thank you so much, Ina. We appreciate the opportunity to be a part of this, and we want to thank Dr. B for the connection. I want to pause a moment and see if Dr. B wanted to say anything.
I just want to
introductory
welcome,
comments.
just welcome Jennifer. It's great to have a classmate and somebody from University of North Texas come on. She's got a great opportunity to share with all of us. She's part of the Texas health system down in the healthy aging, I think, isn't it? It's a program.
Our Center for Older Adults.
Yeah,
The name has changed several
Okay.
times, but it's now it's
Okay.
the Center for Older Adults.
So,
Yes,
but
sir.
I just welcome Dr. Severance. I appreciate your time and wanting to present.
Thank you. Thank you. Dr. Ross is also on the line, and I wanted to introduce myself. I am a associate professor at the Texas College of Osteopathic Medicine. We're at the Department of Internal Medicine and Geriatrics. And my background is as a gerontologist in community and public health settings. Dr. Ross?
Yes, I'm a geriatrician and also a certified medical director. So I work in a nursing facility here in Fort Worth, as well as at the university with my outpatient clinic, and we take medical students with us. And so I've had an appointment here at the College of Osteopathic Medicine for about 13 years.
Thank you. And so we'll move on into this next slide. So what we wanted to bring today in talking with Dr. B was the opportunity to share some of the education and training products that we have developed as being a geriatric workforce enhancement program. We have been a geriatric workforce enhancement program, or GWEP, since 2015, but were recently refunded by the Health Resources and Services Administration as one of 42 grantees in 37 states. So I'm not sure how many states are represented here today, but this may be of interest to find out, and I can provide a link that maybe can be sent out afterwards that you can see what may be relevant to your work, as this is a great network of different kinds of institutions that really act as a resource to their states or regions in workforce development. So we have, as I said, recently been awarded for another 5 years. And our primary goal is to educate and train the primary care workforce to care for older adults. And our purpose is really focused on the Texas area and the Oklahoma area because of the partnerships that we have developed that I'll mention. The overall goal in this training and education that we are developing is to improve health outcomes for older adults. And really, to do that, a lot of the strategies are to maximize engagement in the community by older adults and their family members, integrate geriatric content into primary care training, and then partner with community organizations so that the care that's provided to older adults is not just addressing physical needs, but also social and environmental determinants of health as well. And then there is a focus on age-friendly and dementia-friendly care. And Dr. Ross is going to talk a little bit about that framework in one of the slides. So we'll move on to the next slide. We have so many partners that we're excited to be working with. That includes several academic institutions, including Texas Christian University here in the Fort Worth area, Oklahoma State University as well, and Midland College in West Texas. So there are various health profession education programs that we'll be touching through these partnerships. We also are partnering with North Texas area federally qualified health centers in the North Texas area. James L. West is a dementia care community specializing in dementia care. It's a nursing facility and skilled nursing facility here in Fort Worth. And then Cantex, you may be familiar with their network of nursing homes in Texas and surrounding states. The Methodist Health System is a partner. AgriLife Extension, you may be familiar with them. They provide community education in every county in Texas. And I think they have a similar extension network or Office of Extensions in Oklahoma as well. JPS Health Network is our public hospital system here in Fort Worth. The Area Agency on Aging is a partner, Alzheimer's Association, and MedStar that provides emergency management services. So it's through these partners that we develop training and then be able to distribute that training to their respective audiences and health professions. Next slide, please. So I was mentioning about their respective audiences. really what we are looking at are three primary workforces that our training is oriented towards. This includes those in practice, healthcare practitioners across a variety of settings of care, students as well, health profession students. So we want to be sure that we are training the future healthcare workforce by working with a lot of different education programs. And then supportive care workers. So this is a new audience for this type of grant where we're looking at those providing direct care. So this could be certified nurse aides, but it also can be those working in the community, like community health workers and other community educators. Where our directive is looking at bringing these training programs to those types of workforces, especially those in underserved communities. So HRSA has designated different geographic areas and organizations as tribal organizations, rural, and other underserved communities. And again, we want to do these through partnerships, working with partners who are trusted organizations in these communities. And then training can happen across different settings, and they're listed here. Primary care is really evolving to not just happen in a clinic or a hospital, as you know, or even in long-term care settings, but we're also including assisted living, senior housing, in the home, and adult daycare and senior centers. So these are the different places where training can happen. And you can see that picture there is of the senior center from my hometown in San Angelo in West Texas. And on the next slide, I'll turn this over to Dr. Ross.
Thank you. So I'll talk a little bit, I guess Dr. Severance provided a little bit about the audience and communities that we are charged with providing support to through this funding from HRSA. And then I'll talk a little bit about the content, both of what we're focusing on and what we already have available that's been developed in projects under this funding from previous years. And the real brief overview is really using the age-friendly 4Ms framework. And age-friendly health systems is an initiative of the John A. Hartford Foundation and the Institute for Healthcare Improvement. And the Institute for Healthcare Improvement now has a designation that can be received for healthcare institutions, nursing facilities, clinics, hospitals as an age-friendly health system. And in order to gain that designation, the health system basically shows that they're providing age-friendly care, addressing these 4Ms with regularity and consistency. And the 4Ms are what matters, which can include advanced directives as well as preferences and goals of care in general. Medications, obviously reconciling and avoiding high-risk medications in older adults. Mind or mentation, which is about delirium, depression, and dementia, assessing and addressing those potential risks. And mobility, ensuring that older adults are maintaining mobility to their ability and addressing fall risk and things of that nature. Next slide. Thank you. So under the age-friendly forums framework, there's room for all sorts of topics. Most of what we do in caring for older adults can kind of fit into one of those categories. And this slide just has some information about content that has already been developed and is available today. So the list of modules on the left-hand side is really a primary audience of health professionals in practice that are providing primary care and in an outpatient setting typically, although a lot of the content is not specific to an outpatient setting. So that list I won't read, but a variety of topics that we've created online 1 hour's free CE modules through HRSA funding, and have also been able to maintain them. So some of these were created back in 2019, but we review it every 2 years, update it if needed, and renew those continuing education credits. So they all have free continuing education credits, most of them for a variety of disciplines. So it might be for social work, physician, nurse practitioner, physician assistant, physical therapy potentially, pharmacy potentially, depending on the module. There's just a few little content that is specific to the nursing home workforce and nursing home team members. And so that's what's on the right, is we have 5 mini modules about caring for persons with dementia, and some topics related to behaviors, oral health, engagement in activities, mobility, so that content is specific to caring for persons with dementia in a nursing facility setting. I think that's all on that. I'll go to the next slide, and Dr. Severance is putting the links to the content that we're talking about there in the chat as well. And the content on the previous slide all has CEs attached to it. The eye care program, which I'll talk about next on this slide, is for ombudsmen and residents themselves, family caregivers of residents. So this content, eye care or infection control, advocate and resident education, is also available now. And is not for CEs, as it's for that lay audience. The content is designed for use by really anyone in contact with residents in a nursing home, again, ombudsmen or families or CNAs. And so you can see the 7 areas that are covered here. Dr. Diana Cervantes is a epidemiologist in public health who has a special interest in nursing home, and has created this content and is working to implement it through Cantex, the partner that was mentioned, working with some facilities in North Texas to help them basically create a quality improvement initiative surrounding infection prevention and control. And the other thing that's important to note is that it's a balance of that infection prevention control in a way that respects residents' rights, and that there's taking into account how some of the things that we do for infection prevention control might affect that individual, and discussing how to balance those resident preferences and community considerations in the environment and things of that nature. Next slide. And the other program to mention is Project ECHO. So I don't know if any of you have heard of Project ECHO before. ECHO stands for Extension for Community Health Outcomes. And it there's lots of ECHO programming across the country. And in short, it is a webinar, or sorry, a virtual session that's not a webinar, but that's more interactive. You know, it's on a virtual platform. But the content that's more just an individual presenting a PowerPoint is only a fraction of the time spent, and the other time is spent in discussion and case-based learning, where participants are bringing challenging problems to the table for discussion. We did this during COVID with nursing homes, and it was so interesting and enlightening and helpful for you're hearing the types of problems that facilities were having with implementing infection prevention control measures, and just problem solving and troubleshooting together on those types of topics. So we've done a variety of ECHO programming across the years, and we're currently working with residency programs for family medicine and internal medicine residency programs to provide enhanced geriatric training to those physicians in training that are in primary care training. So I'll leave it at that for now. And Dr. Severance was going to wrap us up and then have time for any questions that y'all had for us. If you could go to the next slide.
Thank you. Thank you. So as we had mentioned, we just received this funding this summer. We have many products to share now, as Dr. Ross was sharing, but we have many more to come. So we wanted to be sure to note that. We are working with our partners at James L. West and Alzheimer's Association to develop a dementia specialist certificate for direct care workers, including certified nurse aides. So that those first 2 modules should be coming out this year. We also have an online module in age-friendly care and for persons living in the community with dementia. And our audience there is for community health workers. And then we're also going to be providing individualized coaching for teams that want to apply that age-friendly 4Ms framework in their setting, including in long-term care as well. So we will have stipends available for those teams that want to participate to help them, to support them in quality improvement cycles that can impact their residents. So those will be coming out soon. And I think this is a time when we just want to be able to find ways to distribute the training that's coming out, but also to develop content that people are interested in, that people feel like is needed, especially this group that has this very unique expertise of care in long-term care settings. So I hope to leave that invitation out.
And I think we've shared all the links, and then she just shared our email addresses. But yeah, that we just wanted to provide an overview. And again, we really appreciate you guys taking the time out of your agenda to include us, to get to know a little bit more about U.N.I.T.E and to share a little bit about what we're hoping to accomplish with this funding across the next 5 years.
Thank you. Are any questions?
Yes, I wanted to mention, so Morningstar here in Wyoming, we are part of the Wyoming GWEP. And so we are already started on this program, exactly what you just said. The other partners on the reservation here are Wind River Cares and then our Eastern Shoshone Tribal Health, along with Morningstar. So it looks like it'll be a really fun journey.
Yes, which GWEP did you say?
Wyoming.
In Wyoming, okay. Okay, and I believe Dakota has one as well. That's the other one I was thinking of that I know already has some good connections.
Mm-hmm. Yeah.
Yeah,
Thanks for sharing.
Very
That's
good.
great.
Thanks, Dr. Ross, Dr. Severance. One of the things too, if you, many of you have Relias Learning as part of your learning management platform for HR. The programs, you could get a hold of your Relias Learning contact, and they'll actually let you build your own platform and include these into it. So that way you can track it for your staff and from HR and actually build that platform. This is one part of your credentialing. So that way you not only get the CEUs from what they've done at QEP, but you can actually take advantage of it for your team. And it goes towards, you can share that with state when they come in and look at how you're professionally developing your staff.
Well, that
And
sounds
I
like
guess
a lot of
to the
resources.
question, if I can just throw out the question, is there anything that this group wants to share with respect to, again, we shared kind of what we've developed in past years as we move forward, are there any considerations that you guys wanted to share with content topics or special topics, that there needs to be more free content for education and staff development available?
I would advocate for Jerry Psych or any kind of training with the dementia people that have real serious behaviors. I think there's such a lack in our country anyway, there is. And helping caregivers understand the severe dementia. We don't have any Jerry Psych people. I don't even know in the whole state. So that's really a need that I see all the time.
Yeah, I would reflect that too, Kylie. Is we have kind of 4 pillars that I'm working on, and Gerald Psych, polypharmacy is an issue, behavior issues, the historical trauma with social disparities of health, how that impacts. And so we're looking at that aspect and sharing that with. I was just talking to the medical staff in just brain science, just sharing with the staff and understanding brain development and function and what are some of the challenges, and then nutrition management. So food is a medicine for us. And so how do we integrate food into that recovery process and replenishing? So that we kind of tend to think clinical, pills. And it's like, no, we can look down to the food and hydration and how that has an impact on it.
Absolutely.
Thank you.
Thank you.
Do we have any other questions for Jennifer or Sarah before we move
All the
on?
question I had is that you mentioned you're kind of in Oklahoma and Texas only. I work with the Southern Plains Tribal Health Board, which is that region, but many of the tribes and facilities that are on are beyond that. Is that still utilize you? Is it okay to work with you?
Yeah, and in particular, obviously contents that's endurable content online that's available is reaching beyond the borders of Texas and Oklahoma. As Dr. Severance mentioned, there's GWEPs in other states across the country, and as was mentioned a moment ago, there's connections potentially there as well. So, but there's not any rule that says we can't work with somebody from Colorado or wherever, it's all hopefully very synergistic and collaborative.
Yes, and we'd be happy to make those to facilitate those connections as well.
Well, that's very nice. So being able to connect no matter where you're at. So love it. Is there any other questions or anything else for Dr. Jennifer Severance or Dr. Sarah Ross before we move forward?
Jennifer and Sarah, I just want to say thank you for coming on today and exposing us to what you're doing. It's very, very enlightening.
Yes.
Thank you for having us.
And Dr. B? Oh, you're on mute.
I was just clapping my hands. Round of applause.
Oh,
Thank
I
you very
see.
much, Dr. Silverman.
Thought you had your hand raised.
I'm not quite
Yes.
as fancy as Travis at using all these little flags down here.
Got to try them out.
I know.
Yes, thank you, Sarah, and thank you, Jennifer, for joining us and presenting to the U.N.I.T.E members here. So, and then thank you for sharing in the chat as well all your links. So I was starting to pull up everything. So do you have something else?
Get an idea of how many people are coming to the annual meeting?
No RSVPs yet, but can we get like who we have here right now that might be attending?
Yeah.
Okay.
Kaylee and I will be.
So 4, Jared,
Yes.
5,
I'll be coming with a board member. So
okay. So 7. Jody, you will be there. And you said how many with you, Jody, that will be there?
So I think there will be a few of us popping in and out just to make sure that you guys get to see us. But my understanding is that Amanda is assigned to something else at the same time. So she's going to miss the entire meeting. Unfortunately, I'm sure she's going to try and pop around to say hello just so you guys can meet in person. But I don't think she's going to be able to attend the meeting. But there will be either me or one of 2 other folks. So 3 of us total, but we'll be kind of like popping in now just so you have a chance to talk to whomever you might have questions that are working on nursing homes here.
Okay, thank you.
Travis, are you going to make it?
Travis is going. I think he was gonna.
Going, okay.
Yeah.
Travis. How about you, Deb?
6 of us from Medicine Will.
Okay. So, okay. So about 17, maybe 20, depending if anyone comes with like Travis, if he brings anyone and stuff like that. So I guess we can account for that number in attendance, and more the merrier. So looking forward to it. All right. So in new business, is there anything new that we need to talk about before we end our meeting today? Any concerns, anything? That's okay if there's not. All right. Well, with that, our next members meeting will be December 19th. And so we'll get that link if it's, I think it's already sent out, Christina, with KAI. And I think we're gonna go ahead and adjourn for today. So again, I'd like to thank everyone for participation and coming on to the meeting today. And our next meeting will be in Nashville, Tennessee. So exciting. And so I look forward to seeing everyone there, if not on Zoom. So, all right. Have a
Thank
good
you.
day, everyone. Okay, see you.
Take care.
Bye.
You.